Welcome to the Posture Strength and Mobility Podcast. I'm Isaac Osborne, and I'm here to share with you tips, tricks, hacks, interesting musings, and much more in short, digestible episodes. To learn more about how you can improve your posture strength and mobility, check out the show notes for links. Onward with the show. Welcome to episode 10, how to reduce swelling in the knee with movement. In this episode, I will talk about the mechanism behind movement that allows you to reduce swelling with movement. I will show you 2 different ways to reduce swelling in your knee with movement, and why ice does not reduce swelling. Before we get started today, I want to thank you for joining me and for listening to the podcast or watching it here on YouTube. If you like the show, please give us a rating on Apple or Google so that more people can find this and get help. It's a great way, non-cost way to get information out there. It helps me get more information out there. It helps more people find it. So my goal here is to help as many people as possible with the knowledge that I've acquired by studying different aspects of movement and body work from the injuries that I've sustained and how I've been able to recover from them. This podcast today is somewhat personal. I'm not going to get too much into the history of my injuries. I'm saving that for another episode, but know that I've had many knee injuries, and knee injuries are no fun. I've had multiple surgeries on my left knee, and I've had surgery on my right knee. Again, I'm going to tell this in a different story on another podcast, but just know that I have plenty of experience recovering my own knees and also working with other people in recovering their knees. Let's jump right in and talk about the points that are the most important for this podcast. Is what is swelling in the knee? Number 1, waste products from inflammation. That's what swelling is in the knee. It's fluid, and it's the waste of the inflammation. So inflammation is not bad. Inflammation is a good thing. It's your body's response to healing an area. It sends healing elements to the area, and this is what causes inflammation. In reality, what inflammation is a healing event. It's trying to heal. It's a chemical response that's trying to heal your body. The swelling in the knee, that fluid, is all the waste products from the inflammation. It's from the healing that is happening in your knee. Now, why does the knee swell? The knee is swelling because there's a lack of circulation that is going through the joint. And if there's a lack of circulation, then the lymph can't drain that joint properly. The blood flow can't drain the joint properly, so it swells up in the knee, it expands in the knee. Now, there's different reasons why a knee might swell. There could be a mechanical issue with the kneecap of the patella rubbing on a certain part of the knee. In that case, then your knee is going to swell to try to get that bone, get off of the femur so that you have more space between that bone and the knee. Where if you have an acute injury, then you stress a ligament, you stress a tendon, you stress something in the knee, or you have damage in the knee from maybe a meniscal tear, or you stressed the knee somehow and it's causing swelling in the knee, and maybe you fell on it or whatever. So that inflammation in the knee, that swelling in the knee, is damage. The inflammation is going in there to heal the area, and that inflammation and swelling is waste products that need to get out, but the lack of circulation isn't allowing that joint to drain. So this is where everyone says, oh, shouldn't I ice it? And I'm going to tell you why ice is not good and movement is so much better. The number 1 reason why ice is not good is because ice causes constriction in the tissue, and it will backflow lymphatic fluid. So the lymphatic fluid is backed up, it swells, and it increases the swelling of the joint. Now, this swelling, we obviously don't want to increase the swelling of the joint because you're adding more cellular waste around there and it has a harder time to heal. It's going to slow the healing process down. The second reason why you don't want to ice is it that it numbs the tissue. And you say, well, Isaac, hey, it hurts and I want to numb the tissue because I don't want to feel the pain. Now, you either take anti-inflammatories or whatever, which is a whole nother issue that we're not going to get into today. And I don't think that those are a good option for you. Talk to your doctor, all that stuff. Do your research. Anti-inflammatories can be extremely harmful to the organs in your body and many other things, and they're dangerous. So you have to be really, really careful on how you use those. But the numbing of the tissue isn't good because it shuts off signals that tell you if you're doing something harmful in movement. You want those signals there. And when you reduce swelling, it reduces pain. The best mechanism for reducing swelling is actually movement. Movement is the number one mechanism that you want to use to get swelling down. So now I'm sure you're asking, how does movement decrease swelling? Muscles. Muscles not only move the body, stabilize the body, they pump fluid. Lymphatic fluid is regulated by two things. It's regulated by movement and it's regulated by gravity. Those two things are how lymph fluid. There's the main mechanism behind moving lymphatic fluid throughout your body. This is why the major lymph nodes are in your armpits, they're in your groin, behind the knee, in the abdomen, in your neck. They're located at these places in your body where the most movement happens. We want to take advantage of those two things. We want to take advantage of gravity and we want to take advantage of movement. Muscles are what pump fluid. Muscles really do an amazing job of pumping fluid. When a muscle contracts, it pushes fluid out, and when a muscle relaxes, fluid goes in and fills that space up, and then it contracts again and it pushes that fluid out. So the more muscle contraction that you get through movement, the more movement of fluid, of blood and lymph that you get throughout your body. Your knee is swollen and it's hard for you to walk. So how do you get movement into a joint when it's hard to load? And this is where I have, later on in this episode, I have the tips on how to do that. I'm going to show you multiple different ways on how you can do this. And the first way that I show you is we're going to be using gravity and we're going to be using movement to do this. So what we've covered so far are just real basic physiology of why movement can reduce swelling by moving fluid through moving your musculature. Before we get into the movements that will help you get this fluid out, I want to mention one more thing. If we try to work a muscle too hard, meaning we try to work too fast, we try to contract too much in the musculature, you risk overdoing it with the musculature. Then that's not going to be beneficial either. So what I recommend in any of this type of movement is that you just move slowly, methodically. And you don't have to cause a lot of muscle burn in the body. Take your time, be patient. This is the thing with most injuries, most people don't have enough patience to heal. This is why you take anti-inflammatories or you take drugs because you have to get on with your daily life. I get it. I totally get it. However, be patient with your body. Listen to your body. It's going to tell you what's right and what's wrong for it. All right, let's take a look at the two different ways that you can use movement to be able to reduce the swelling in your knee. Here we go. For the first way to reduce swelling in the knee, we're going to bring our legs up the wall. And I'm going to show you a number of different ways to be able to do this and based off of your function and what's going on in your body. First way is really basic, and you're just going to lie on your back, bring your legs up the wall, and you can just hang out here just like this. So gravity will help drain the swelling out of the knee. In this position, you can do that. Just lay here for about 5, 10, 15 minutes, and gravity will drain the swelling in the knee. to get more out of this position, what you're going to want to do is either take a foam roller, uh, a folded up yoga mat, or even a folded up towel. I'm going to use the folded towel, and I'm going to place the towel behind my calf. What happens is when you place the towel behind the calf, it brings that leg off the wall. So if your butt is up against the wall and this creates a really large stretch for you, then scoot your butt away from the wall and it won't be as intense. Don't place the towel directly behind the knee, but place it on the calf muscle so that your heel is off the wall. By placing a towel behind your calf, what you're doing is you're forcing your leg to kind of push against the wall, and this will help straighten your knee. A lot of people, when they do this position, they bend their knee, and you really want to straighten the leg, keep the knee straight, and have your quad muscle engaged the entire time. Now, all you have to do is just do these pumps like this, where we're bending at the ankle, the top of the foot comes towards the knee, and then you just relax. Towards the knee, and then relax. Towards the knee, and then relax. And if you want, you can also bend the ankle away and point the toes, and then bend back, point the toes. So it's basically point and flex, point and flex, point and flex. And do this for about 20 to 40 reps. You may feel a burn in your shin. Just go ahead and relax, stay here in this position, and then go ahead and pump for another 20 to 40 reps. Do this on a cycle multiple times a day rather than trying to get it all done at once. What this will do is this ankle pump pushes essentially fluid out of the leg. It'll bring blood flow into the calf, but it pushes it out of the calf much faster, and it activates lymph in the back by having that movement in the calf muscle and the soleus muscle going in a stretch, contraction, and that's going to pump fluid out of the knee. Remember, muscles pump fluid as part of their job. Aside from providing us movement and stabilization, they pump fluid throughout our body. For the next movement that's really effective in reducing swelling in your knee is riding a bike, stationary bike. I have this here. This is the Echo bike from Rogue. I'm not anyways affiliated with Rogue. This is the bike that I chose to buy from them. And you can use a regular bike. You can use a bike, with those bikes where you put it on a stand. And when you get on the bike, this is the Echo bike, so it's similar to an assault bike, and so it has the handles. But what I recommend that you do is you either do hands-free, and if you can have your hands on the handles, if you're doing it in an assault bike, just go slow. You don't want to be extremely rapid in the movement. What you're going after is you're not going after muscle fatigue. You're going after just having those muscles move and pump. So if the knee typically is swollen, the knee is already sore, so you don't really need to go to town on getting those muscles contracted. All you have to do is just get into the movement. So get on the bike, spend about 10 to 15 minutes, even 5 minutes can do a lot. That motion is going to help pump that fluid out of the knee. So just be careful, be mindful, especially if the knee is sore, and go at a slow pace. Do it for 5 to 15 minutes, and that will help reduce the swelling in the knee. You can do that multiple times in a day because you're not exhausting the musculature. You're getting that movement in the knee. One thing I forgot to mention about the bike was that if your knee is really swollen, sometimes bending your knee can be uncomfortable. So if you raise the seat high to where your knee doesn't bend very much when you're riding that stationary bike or riding a regular bike, then you don't get as much bend in the knee and it can be more comfortable with the knee. Thank you for joining me for this episode. If you liked it, please subscribe and leave a positive review so others may find it and get help too. Check out the show notes for links on how to win a mini integrator massage gun, posture strength and mobility classes that focus on corrective exercises, or self-myofascial release protocols for neck pain, back pain, knee pain, plantar fasciitis, and much more with my massage gun, the Integrator. Until next time, keep exploring your body and stay curious.